Hi. So I have a story for you guys because I have a special guest today. The story is a few years ago, I was having a bit of an issue with my psychology and I decided that I should see a therapist because I was having sexual feelings for one gender more than I was having romantic feelings for another gender. And I thought this was distressful because I thought that you should have either all on one side of the fence or all on the other side of the fence. So I went looking for a therapist and I thought, who should I possibly go to? And I thought, a sex therapist. Mistake. Because I had therapy and I was there for 6 months, $200 an hour, and we addressed bisexuality maybe 4 times. So that you guys can prevent that little problem, I have today as a guest, Dr. Mary Andres. And she is like what I like to refer to as a Yoda of bisexual therapists. Welcome!
Thank you, Alex. It's really nice to be here with you.
It's wonderful to have you here. So just to start out, what type of therapy, just briefly, do you practice?
I practice postmodern therapy, which means I really focus on the present and the future, more so with my clients. I'm trying to get a sense of who they are and what they want to accomplish in their life.
Okay. Bisexual therapy. What is it?
Bisexual, I'm going to call it bisexual affirmative therapy.
Okay.
And what that means is somebody who has training and competency to be able to look at a bisexual individual and not think of them as less than a heterosexual or a gay person, but to really think that this is a viable option. So they're going to understand both identity and behavior and how that intersects with things like culture and class and everything else in their life, their relational status, and they're going to pay attention to those dynamics.
So what was my mistake? Because I went to a sex therapist and, bisexuality has to do with sex. But I did not get that feeling that I think one should get from therapy. So what's the difference?
Right. Well, sex therapist is a field that specializes in addressing sexual behaviors oftentimes. So it's more of an intensive therapy. So if you had like erectile dysfunction or a desire problem, or then you could go to a sex therapist and they would help you specifically with those problems. But it ends up being more behavioral. Sometimes it's related to identity, but that's not the emphasis. What you really wanted was somebody who understood the identity dynamics related to being bisexual and was able to address it culturally, not just behaviorally.
And I think the culture thing is very important because I went to see another therapist recently about another issue, and they knew that I was bisexual. And in there, he'd said to me, I think that you should find some community. And he said, perhaps you should go explore the gay community. And I was like, why? Yeah. And he thought it was somehow me rejecting my own identity in some way, as opposed to, no, it's like someone from another country. Yeah, we're all human, we all have similar things, but completely different culture.
Very different culture. Yeah, and so you want somebody who's going to understand that you might face both kind of warmth and rejection on both sides of the straight community and the gay community, because that person is pushing you toward a community where you might have had some bad experiences.
And what is, because I've heard this phrase before, what is therapist bias?
Therapist bias is when it's kind of being smug in a sense, when a therapist has a sense of what's right for you and that unconsciously influences how they talk to you.
Like, so for example, let's say that, there are people out there that think, okay, well, I should go see a LGBT therapist. And they go research it and they find one. And then they find their experiences and know exactly what they're looking for. What could be something they could be encountering?
An example of bias. I had one person that I knew who went to see a gay male therapist. So the therapist was personally identified as gay, and he was in a relationship. He was not monogamous in his relationship. And his bias is gay men can't be monogamous. Like, that was his experience. And so the person who I knew who was seeing them was like, but I'm an idealistic person, I want to be monogamous, and that's cynicism. He took it as cynicism. That was the therapist bias.
And are there actually times when it's more than just bias, but just straight out ignorance on the topic?
Very much so, very, very much, because I think that sexuality is such a primitive issue for all of us, and for some folks, we just haven't examined it very well, and that happens quite a bit. So clients will only tell the therapist what they're comfortable hearing. And,
yeah, that's
and
true.
so if you bring up something to a therapist and they look startled or they look uncomfortable, you end up editing what you're going to talk to that therapist about.
Yes.
And maybe that's why you only spoke about being bi 4 times in the course of, that's...
Well, I brought it up, but it was, I mean,
Yeah.
don't get me wrong, I got a lot from it because apparently I had a lot more issues than just that. But I went in there very specifically to deal with it,
Yeah.
and it wasn't dealt with at all.
Yeah, one of the things I do is I train therapists on how to do therapy, and they'll talk about like, oh, I know how to establish rapport, like I know how to make a client feel welcome, but I'm afraid when they'll bring something up and I won't know what to say next. And that's what you learn in training. It's like, what do you say next? And part of being culturally competent is nothing you say scares me. I'm not afraid by what's going on in your life. What I'm doing, my role is to not be afraid. My role is to be a safe person so that you can explore those unknown parts of yourself. And so if you get scared, I'm still going home to my life. I don't need to be scared with you. I need to be a stable holding environment.
Yes.
Yeah.
You mentioned something in there that I thought was interesting that a lot of people might not realize, but by culture, like there's a difference. There's actually a difference between being bisexual and being gay and being straight. Like there's a... Now when you say culture, do you mean like the social aspect, or do you mean something more?
I think it's something more. I think that there is that socialization, and where does this person feel supported? Because all of us go out in the world looking for role models. So it's like if you don't see models of yourself on television, if you don't see representation, you feel less than, in a sense. And then when we see a character and we're like, yay, finally somebody that reflects my experience in the world. So that's part of biculture, just that representation. But then there's also the validation. If you are a bisexual person and all of your gay friends are super excited when you have a male partner, but then when you start dating somebody female and they don't invite her around, they dismiss her, they treat you differently, then you're not being supported. So everybody doesn't have to be bi to be part of bi culture, but they have to be supportive and affirming of your bi identity. And
some of the things you might want to deal with in therapy is, for example, like I am not much for dating guys, but most of my friends are mostly straight, and they know I'm bi, and they said that logically. And I'm sure if I ever brought a guy over, they'd be all cool with it.
Yeah.
But me, myself, the idea of me bringing a guy over to meet my straight friends, even as open as they are, would be the type of thing that I might want to talk to a therapist about because.
Right. How do you integrate your life? Instead of you having this compartmentalized part of your life, like maybe it's not somebody you're just hooking up with, but somebody that you genuinely are friends with and that you like, but you feel like you're treating them as less than because you're not introducing them to the other people and experiences that you value.
Right.
Yeah.
So this is all great stuff.
Yeah.
Now, people are watching this and they're thinking, great, so how do I see a bisexual affirming therapist? How does one find one?
The internet is so wonderful. Everybody needs to just learn how to use the internet well. You can put in bi-affirmative or bisexual affirmative therapy and see what comes up. What I usually do when I'm searching for therapists is I look for, there's a couple of lists that like a psychotherapy finder, which Psychology Today has a list thing that you can do by zip code.
And I'll put a link in the description below.
Great. And you can go to Psychology Today's therapist finder list, put in a zip code, you can put in your insurance, and you can put in, I don't know if it says bi-affirmative or it definitely says LGBT, and it might even say bisexual clients as well. So you use those as ways of searching. Now, the thing about that is those are people that pay to be on a listserv. So you get some limit, but that's one option, is to just use the internet there, read websites. If you're anywhere near an LGBT center, most LGBT centers either have resource lists or they might even have counseling centers right at their center. I know that we do in Los Angeles, and I think that Long Beach does as well.
And talking about bias, even when you're going to these centers or even when you're looking at lists that say LGBT, you then have to further ask them, whether or not whether they have a bisexual affirmative therapist there, correct?
Exactly. Yes, and for people that are near a college campus too, campuses tend to be the most liberal spot in terms of LGBT identity, and they really tend to have counseling centers that either have queer representation at the center, or at least they're gay affirmative. And you can call a counseling center and say, I'm looking for a bi-affirmative therapist locally. Do you have any names that you could recommend? Chances are what they'll do is they'll either have it listed, or they'll have somebody who is gay, lesbian, or bi who knows what bi-affirmative means.
Okay.
So you're not talking to somebody who's completely ignorant, and they'll be able to give you some local resources.
Okay, and if you're on the Affordable Care Act, it can get complex.
Yeah.
It's different depending on the state that you're in. Many times, if you have an HMO, you'll have a list of doctors that you can see. You can check to see if they say LGBT, and then you can give them a call and ask them if they're bi-affirmative, and they should know what it is, and hopefully it'll give you the correct answer, the real answer.
Right.
If you have like a PPO, getting really detailed now, but you can have your own therapist and then have it partially paid for by your insurance. And if you have insurance that's being paid by the government. You recommended a phone number.
Oh yeah, 211. So most people, the United Way sets up a call center for the number 211, the same way you call information, which nobody does anymore, under 411 or 911 for emergencies. 211 helps connect you with health networks. So it could be homeless shelters, but mental health is part of that. So you can call, you can tell them your area code, you can ask, based on being on like Medi-Cal, where do I get help? And they're so patient at the 211 place. So it's a great place to call and ask for resources. Anytime you're calling to make an appointment, one of the things that you can do is just ask when you're in the screening, do you have somebody who's bi-affirmative? A relationship with a therapist isn't going to just be a forced situation. It's like dating, like sometimes you're going to hit it off and have chemistry, and sometimes you're not. Do not ever feel bad about sticking with a therapist that you don't like. If you go to someone and you feel like, oh, they looked good on paper, but I'm not feeling it, trust some of your instincts there, because therapists should be working to make you feel safe and at home with them.
And I will say this, I don't know if you'll love this analogy or not, but I like to think of therapists kind of like mechanics.
Okay.
A lot of people can change their own tire, right? And then people can maybe change the light bulbs on their lights and stuff like that, little basic things. But no one thinks, oh, if my carburetor goes down, I can just rebuild it, or I can just like change any of the major parts inside of the car.
Yeah.
They go, no, I need to find a mechanic.
Yeah.
And the same thing is true with a therapist. I mean, there are certain things that we can self-soothe ourselves with many things.
Right.
But there are also things that you kind of have to go, there's someone who knows more than myself, and it's not some sort of negative thing towards you that you're going to see a therapist. It's actually being kind of smart. When I went to see a therapist, it wasn't because my life was falling apart. It was because I felt that I could have a more efficient, more productive life. So I was doing fine, but I wanted to go up a level. I wanted to rev the engine, sort of thing.
Yeah.
So I went to see a therapist. So if you have any sort of moment in your life where you're thinking, perhaps I'm feeling kind of down, or perhaps there might be a better way that I can handle this situation, or I'd like to integrate different parts of my life into my life and my friends and my family, then I recommend seeing a therapist. You can always find one that's within your budget, and it'll probably change your life. That's all I'm saying. I'm just saying it might change your life. That's all. But I'd like to thank you for being here, and if it's okay with you, I'd love to do more videos with you.
That sounds great.
Here we go!
Yay.
So if you'd like to find out more information about the stuff we talked about, you can find it in the description below. Subscribe and like this video so other people can find it and enjoy it as well. Until next time, stay cooler, my bisexual friends. Stay cooler. Bye.
Bye-bye.